I'd like to welcome first up for our first company presentation, Peter Harrison from Bioventix, who's a regular attender at these seminars, and I'm sure you know him well. He's going to update us on the latest happenings at Bioventix. Welcome, Peter, over to you.
Thanks for that kind introduction. Next slide, please. I know there are quite a few regular viewers here, but I will cover some of the basics of Bioventix activities. And it's all based on large volume blood testing. And this takes place at hospitals around the world where robotic machines manufactured by large multinationals such as Roche, Abbott Laboratories, Siemens and Beckman Coulter are able to perform a variety of blood tests on human blood samples. Blood samples get taken. You've all done this before, and it gets trafficked to local pathology laboratories where tests are performed by these robotic machines. All the tests have reagent packs, and in each reagent pack will be specific for a particular blood test. And at the center, at the heart of the reagent packs is often an antibody. And there's an antibody which binds to two antigens. And the way that the tests are designed is that the antibody is specific for the particular hormone or biomarker that is desired to be tested for. So if, for example, it's a blood sample that's being tested for testosterone hormone levels, in the reagent pack, there will be an antibody to testosterone, which has not yet found two testosterone molecules. So those light green circles would not be there. So the antibody in the reagent pack is waiting to bind to two molecules of testosterone from the blood sample. And when that binding event takes place, it's detected by complex chemistry within the machine, and then the result is quantified and then traffic to the clinicians or doctors that who have requested the sample. And what Bioventix does is that we create antibodies as part of our research activities. And then if they're of interest to our customers, Abbott, Roche, Siemens and Beckman Coulter, we engage in large-scale manufacture, and we then sell these antibodies in pure form, which our customers then incorporate into their reagent packs for use on their blood testing machines. And our business is all centered on the ability to make superior antibodies, which can confer improved tests on the machines or even new tests which don't currently exist. And that's the basis of our business. And we sell physical antibody, and we also have a pricing mechanism whereby if customers such as Abbott, Roche, Siemens and Beckman Coulter incorporate one of our antibodies into a reagent pack for subsequent sale to hospitals around the world, we derive revenues from the physical sale of physical antibody, which accounts for about a quarter of our revenues. But then when the customers sell those reagent packs and associated tests to hospitals around the world, we derive a small percentage royalty based on that downstream transaction between, for example, Abbott Laboratories and my local hospital in Guildford. So and that powers the financial performance of our business because 75% of our revenues are on these downstream royalty events, or we call them royalties. It's just essentially a pricing mechanism for the purified antibody. We've been engaged in this for kind of like almost 22 years now, and we've made antibodies that get used in a variety of diagnostic applications. By far, our biggest seller is for vitamin D deficiency testing. We make antibodies for thyroid function, for fertility testing, and testosterone, estradiol, and progesterone are key hormones of part of fertility biology. We've had great success with heart disease markers for heart attack and heart failure, troponin BMPs, and some drug testing. This is the most interesting area here because right now on blood testing machines, you can have a blood test for almost every organ in your body. If you kind of think starting down, thyroid, heart, liver, kidney, reproductive organs, bone marrow, white blood cells, red blood cells, So blood tests exist, and there's 100 to 200 of them, for almost every aspect of organ function within your body, with one exception. There are currently no tests for brain health and brain function. And that's what I think will be changing, at least our customers think. So there'll be a revolution in neurology testing in the coming years. And I'll say a bit more about that later. So we've got about 30 antibodies that we've made over the last 22 years, which we sell to the global in vitro IVDs, in vitro diagnostics companies, which are Abbott, Roche, Siemens, Beckman Coulter, and some other Division 2 players. And we create our antibodies often through our own internal resources, but sometimes through contract R&D with our customers. And more frequently now, certainly in the area of neurology, we're creating antibodies through collaborative research and development with academic institutes, in particular in Gothenburg in Sweden. I'll say more about that in a short while. The dynamics of the business are worth considering it in more detail. So no matter how we create antibodies, no matter where the idea has come from to make some antibodies, the process is very similar. We immunize sheep, we take out sheep white blood cells, and then through some technology which is pretty 1970s, we then immortalize those sheep white blood cells and ferment them to make a pure antibody against whatever we've decided to create antibodies against. That takes us about a year to go through this piece of 1970s technology. We then send those small samples to our customers, and what they then do in our customers' laboratories, they're able to use tiny samples, like a few mils of antibody, to create a reagent pack in a research setting. What they can then do is compare the performance of a prototype reagent pack using an evaluation antibody, for example, from us, to then compare the results of that blood test against an existing test or some other gold standard. And this is all using frozen blood samples from their freezers, which they store or they can acquire from other providers. What then happens is that they'll form a comparison of the prototype against an existing or gold standard test, and they may or may not conclude that there's commercial merit in proceeding. If they do, then this next step is quite exhaustive in terms of taking this prototype, going through field trials and manufacturing studies, quality studies, field trials, regulatory submissions, to get this reagent pack into a state where there's sufficient supporting data to file regulatory submissions globally. And this is incredibly resource intensive, and it's something which our customers do occasionally when they're so motivated to go through this process, because it costs a lot of money and takes quite a lot of time. And there are a couple of key implications for Bioventix because of these following these dynamics. And the first is an obvious one, which is that between an idea to do something and having any form of revenue from a commercial blood test is around 5 years. So it takes a long time, the lag phase between research concept and any form of revenue generation. So that's an impediment to the growth of our business. And it means a lot of the antibodies that we're selling now, we made many, many years ago. And the antibodies that we've made over the last few years are generally yet to generate revenue. Although neurology is proving to be a bit of an exception. Again, I'll talk about that later. The other interesting consequence of these dynamics is that after a customer has gone through this approval process, then they tend to be very reluctant to change the antibody that's featured in the reagent pack, because it's very well known by the scientists and our customers and the regulators that if you change the antibody, you change the test. If you change the lock, your partner's keys won't work. And because of this reluctance to change the antibody in these tests, it does confer quite a high level of revenue continuity because of the continuity of antibody use in this landscape. I'm pretty sure I pressed. Oh, okay. So here are our financial results for the last year. Disappointingly, sales were down a little bit on the previous financial year. That's had a knock-on effect to slightly reduced profits before and after tax. So I'll come on to explain a little bit why that is the case. And we missed our forecast from Cavendish by for the previous year and for the next year. Again, we're not predicting a kind of any significant growth in our business. For because we're quite highly profitable, I mean, whilst I might sound like I'm disappointed by this, the business still does generate a lot of cash, and that's distributed amongst our loyal shareholders accordingly. As far as our accounts are concerned, they are very, very simple because we're a small company, no subsidiaries, and there's only 12 FTEs. So our accounts are very simple. All R&D costs for some of the research that we're doing are all featured in the cost of sales. But anyway, many of you know more about accounts than I do, so you can peruse the accounts at your leisure. So I won't go on about that any further. This is the split of our different antibodies. Vitamin D has been a dominant antibody in our sales portfolio for a number of years now and continues to be very important to us. Troponin is a revenue stream dominated by Siemens, and troponin is used for heart attack testing to better help doctors diagnose whether someone with chest pain has had an event, either a cardiac event or not. And we had hoped that these sales would increase by more than this, but they haven't. And then we have a core of other historical products which have some have gone up and perhaps more have gone down in the financial year, with the obvious exception of our neurology portfolio, which are all very, very new antibodies, the sales of which have grown enormously from only 150 odd grand to over £600,000. With a lot of physical antibody sales and also some royalties. So rather contradicts what I said earlier about it taking 5 years to generate any significant revenues. And I'll try and explain why neurology is proving to be an exception to what I've been saying to ShareSoc people for the last 10 years. In terms of sales, well, vitamin D was slightly ahead of expectation. The environment is difficult downstream of us, and that's largely a function of what's happening in China. And what's happening in China is that the Chinese central government are being very aggressive in pruning all healthcare costs, and that's had an impact on the downstream prices for finished assays at hospitals. And that's had a couple of effects, specific effects from our point of view, which is that our traditional Western customers, Abbott, Roche, Siemens, and Beckman, we believe have reduced competitiveness in the Chinese market against domestic Chinese manufacturers. So we believe that we've suffered a little bit from that. Also, the Chinese customers who are kind of new and emerging that we have been supplying, they're under cost pressures to switch to lower domestic antibody suppliers, and so that has resulted in some loss of sales from which have been growing over the last few years to these domestic Chinese in vitro diagnostics manufacturers. So the combination of factors that have impacted our revenues, such that the growth that we've seen over the last few years has not been duplicated in this financial year. Troponin was disappointing because we had expected the sales to be stimulated by a new application for troponin testing, and this was in the field of people who not in A&E centres with chest pain, but people who are attending routine cardiology visits because they've got some pre-existing condition, either maybe they've had a heart attack or heart failure, or they've got some other fibrotic condition or some other cardiac pathology, which means that they visit their cardiologist regularly. And it's been shown by opinion leaders that troponin testing in that setting can help stratify the risk of that patient having an impending event in the coming weeks and months. So we had expected that to stimulate sales, but that has not happened. Against the backdrop of some disappointing news, what's happening in the field of neurology, and specifically with tau biomarkers, is that we've seen an escalation of success, both scientifically and commercially, which has driven the increase in sales. So we've now got a number of our antibodies in prototype assays at our customers for use in neurology. We've got a total of 6 antibodies now in manufacture, which is kind of unprecedented in my 22-year history, where each year you might have none or 1 or 2 antibodies. In the last 2 years, we've had 3 and 3, a total of 6 new antibodies that are being manufactured at scale. And I say that's unprecedented. And what's happening is that our customers, Abbott, Roche, Siemens, Beckman, and others, are creating assays, not for routine clinical use yet. So you wouldn't be able to get a test for, say, Alzheimer's disease on a routine hospital analyzer just yet. But there are researchers at UCL and elsewhere in the world who are running tests for research purposes where you can run blood tests and you can tell what's happened to someone's brain health over the last 5 or 10 years, and also predict what's going to happen over the next 5 or 10 years. And that's obviously incredibly useful for Alzheimer's diagnostics, and in combination with Alzheimer's therapeutics, be they lifestyle choices or coming therapeutics. So there's been an explosion of interest in these research use only applications, which will soon turn into commercial routine assays. So the disappointment with troponin comes from the fact that it's been all over the media, it's been in the scientific press, and this isn't opinion leaders in cardiology. It's the American Diabetes Association who back in 2022 recommended that people with diabetes get annual cardiac checkups. So we thought that would stimulate sales at well, Siemens thought it would stimulate sales, but Siemens' efforts to educate and make people aware of the capability of troponin testing hasn't yet stimulated sales. But nevertheless, the underlying rationale for increased testing still exists, and we remain cautiously optimistic that there will be increased sales in the future. I'd quite like to see some evidence of it, but the background reasons for expectation remain solid in my view. In neurology, so there's been an explosion of activity in our lab, and the lab is almost 100% dedicated to neurology diagnostics. And there are a number of projects that we're running which relate to different areas. Well, Alzheimer's is a big one at the moment, where there's 3 areas of disease pathology: amyloid deposition, which takes place in between your brain cells, and then tau tangles, which is another separate Alzheimer's pathology, which is probably linked, that takes place in the wire bit, so-called the axons of nerve cells, where pathological tau tangles form. Both these events lead to brain cell death. And when brain cells die, the technical term is neurodegeneration. And all these 3 areas of disease pathology can be detected using brain scans. So if you've got a PET scanner and you have tracers which bind to amyloid or bind to tau tangles, you can scan a patient using PET scanners with the appropriate tracer or contrast agent, and you can actually see this pathology in someone's brain. Clearly, any form of mass testing or mass screening cannot involve PET scanners because there's simply not enough, and the throughput wouldn't be great enough. However, screening populations using blood samples, all that already exists, because I do it and you all do it as well for cholesterol testing and cardiac testing, etc. So arriving at blood tests which are crucial to the 3 areas of Alzheimer's diagnostics I think a few years ago would have seemed fanciful, but actually our customers at Abbott, Roche, Siemens, and Beckman have now got prototypes which do just that. Not completely yet, but there's one or two areas where there is now fairly established blood tests in a research setting which do just that and inform on the history of brain health and our prognostic of the future of brain health. This one here is, everybody's working really hard on this one because it's such an important area of Alzheimer's biology. So this is an exciting route forward for us. Down syndrome-related amyloid, all Down's subjects get Alzheimer's disease very early. So almost all Down's patients read positive on these blood tests around the age of 50, and they're all symptomatic around the age of 60. And there's a lot of interest in helping Down's subjects with new therapies. We're also moving on to a lot of antibodies that we've made for these applications. We've kind of created them and they're in manufacturing, the 6 I mentioned recently. We're now moving on to other areas of neurology, peripheral neuropathy, which is kind of more associated with diseases which are the lower brain and spinal cord, things like motor neurone disease. And cerebral amyloid angiopathy is another brain disease whereby there's a buildup of plaque in the blood vessels, the small blood vessels that feed your brain, and it's very closely related to vascular dementia, which you may have heard of, and that's a very different disease to Alzheimer's disease. So there's quite a colourful range of activities that we're engaged with our neurology pipeline and its development. What's been really pleasing over the last year is the response that we've had from the people that we talk to. So we're talking to the big blood testing companies, the 4 or 5, Abbott, Roche, Siemens, Beckman, etc., and also some other companies who've historically been quite involved with the research market, which is Alamar, Quanterix, and others. And we've supplied our antibodies for use in these prototype tests. And the rate of the hit rate has been surprisingly and pleasingly high from our parochial point of view. And this is so crucial as a predictor of the future value that we have in what I think will be a very exciting proposition in the years to come. Because when people choose your antibody for a research test that they're sending to academic partners around the world for use on their blood testing machine, if it works well, they will be loath to change anything, even though it's a research only use test. And it's the translation from research use only to routine clinical use. People think that's only a year or two away, and there are already applications to the FDA for blood tests for Alzheimer's disease. We have to wait and see what the FDA response is to that. But it's an indication that we're on the cusp of something really quite exciting for brain diagnostics, and this tells me that Bioventix will be a part of it in the future. There's a very exciting era for us. We have some other pipeline developments, and I won't say too much about these because it's compared to what I think will be a revolution in blood tests for brain health, these will be significant. I think the one I think is kind of quite curious is the water quality project, where you will, if you read the Times or watch the BBC News, you'll know that the state of our rivers and lakes is a disgrace. Sounded like Liz Truss here, but and it's all a function of our Victorian sewage systems, which are affected by heavy rain. As soon as it rains, all of the wastewater, which normally gets processed in wastewater treatment plants, gets dumped into our rivers. And it's an absolute disgrace. I'm sounding like Fergal Sharkey now, but it is an absolute disgrace. And people are quite naturally indignant about it. And we're working with a number of groups with a concept that we're developing, whereby instead of testing for E. coli or norovirus, which are all these things that are in rivers and lakes that will give you diarrhea and vomiting if you go swimming or paddleboarding or triathloning or whatever, the tests for those microbial entities generally takes about a day. So you take a sample, take it back to the lab, culture it, and it takes a day for you to see your colonies of E. coli, for example. Obviously, that's too late. So the concept of this is to use drugs which are in effluent as a surrogate marker. So the idea is we'll have a lateral flow test for caffeine and or paracetamol, which you can dip in the river, read it, and see whether there's caffeine and or paracetamol present. And if those drugs are present, it means that there's poo in the water. It's as simple as that. And the other thing that we'll do, or possibly with a volunteer group, is to incorporate it with phone technology, where you point your phone at the lateral flow test. Your phone will recognise a QR code, so it knows it's a paracetamol test. It knows where you are, and will analyse the result and upload it to a cloud database. And we think that this concept will be of interest to people like Surface Against Sewage, River Action, etc., etc., etc. And we've got some lab-based tests which work, and we're just at the final stages of developing lateral flow tests with a partner company in Bedford. And we hope to start distributing those to volunteer groups, of which there's loads. They all think this is a great idea, sometime early in 2026. I think it's interesting. Clearly, it's not going to be as valuable as what I think will be a transformation in blood tests for brain health. But it's worth, since we're spending money on it, it's worth telling shareholders that we're doing that. What we do in our little lab is, and the plan for the future is pretty much to do more of the same as what we've been doing in the last few years, which is to consider new neurological biomarkers and continue working with people like the University of Gothenburg, because it's fair to say that my knowledge of brain structure and function is nowhere near you guys. But we're working with the University of Gothenburg, where they've got a group of 50 people, and they only do one thing, which is blood tests for brain health. So we're incredibly lucky to be working with that group who take our antibodies and develop prototype tests, publish data on prototype tests that use our antibodies, and our customers find that highly persuasive because they're such a world-renowned group. So this form of collaboration has been so successful over the last few years that we will basically just duplicate that going forwards. Obviously, we've got to look after our little team. So what the lab looks like, with incubators for growing sheep cells and bioreactors where we mass produce the antibodies, and we make about 20 grams of antibody a year, which doesn't sound a lot, but it is. We use these pieces of equipment to purify antibodies, and we also do a variety of technology development work using DNA technologies. That's the team. That's me. I think that was taken a few years ago, so I look a bit younger there. Ian's the chairman, Bruce finance director, and Joe's our non-executive director. We've had various shareholders have suggested that we need more executive directors, and with 2 directors and 9 scientists, we're already a bit heavy on chiefs versus Indians. And also some fund managers think that we should have more than 2 non-executive directors for governance reasons. I get that, and because they start voting against our governance at the AGM. So we are responding to fund managers' concerns about our lack of non-executive directors, despite the fact that my guts tell me with 9 scientists, 5 directors, that still makes me feel uncomfortable. But fund managers aren't wrong. One's learned that over the years. So we are looking for a new non-executive director that suits our needs in 2026. Shareholders, some people here own shares, I know that, but then there's other household names: Gresham House, Lion Trust, Sanford Land, you might have heard of, Hargreaves, Schroders, Investec, Charles Stanley, Rathbones, Danske, Intree. So quite a good shareholder base that we've built over the recent years, largely through the efforts of FinCap and other means. So in summary, where we are right now is that vitamin D antibody sales did quite well, but there are some challenging conditions, particularly in China, which have had an adverse effect on our performance. Troponin was a disappointment. But what's happening in neurology, frankly, is a bit of a revolution for us, and is very exciting for the future. And it's very exciting that, for clinicians and patients and hospitals, that this new vision of blood tests for brain health is happening, and it's exciting for us that we'll play some part of the value chain in that. Something for the future.
Have you got any more slides, or is that? Oh no, it's the end. Right. Okay. Perfect timing, Bruce.
Hello, Bruce. How are you?
Question. Thank you, Peter. Questions, please.
Put that online.
Yeah, and if you're if you're online, please start putting your questions into the Q&A box, and I shall keep an eye on those and read them out on your behalf.
Peter, on slide 9, you have on your right-hand column, it says commercial partners.
Yeah.
Does that mean, where you've got a number, that they have already selected the antibody and it's your antibody and nobody else has an opportunity to play in their assay?
I think in the dialogue box on slide 9, it says that customers will either have chosen one of our antibodies and they've launched a research use only test, or we think they're just about to, or in pending launch. I think that whatever the wording is in that dialogue box.
Okay, and if I understand correctly, that's referring to a number of the large major IVD players, which, if I understand correctly, is roughly 50% of the market. What about the other 50% of the market? How are you targeting them?
Well, right now you've got to remember that there's no market per se for blood tests for brain health, because there aren't any commercial tests. But I think in the future it will be dominated by the big automated machine companies, Abbott, Roche, Siemens, Beckman. They dominate the space, and so those are the key players. The research-orientated people like Alamar and Quantos, also they're very active right now in placing tests in key neurology centres. So we want to be part of that over the next few years. But I think by the time we get sort of late 2020s, when I think routine blood testing for brain health will be taking place, it will be dominated by Abbott, Roche, Siemens, and Beckman, because they're the people that dominate the high volume testing. They're integrated into sample management and the IT systems with hospitals around the world, maybe with a couple of Chinese players getting involved as well.
Hi, I've got a question. You mentioned about this China factor, and I looked at the price. It's sort of coming down. Is it mainly because of this China factor and your share price coming down? And also, how do you foresee in 2026? Do you think the China factor will be still predominant and depressively working on your price of your share?
Well, I'll take the second element of that first, which is that I believe the landscape in China is going to get more challenging for Western companies trying to compete in China, and our antibodies in China with the domestic Chinese companies. I think that competitive landscape is going to continue to be difficult. But I still think we'll, come 2030, when I'll hopefully still be here, we will still have a business in China, but it won't have been, over the last few years, it's been growing quite healthily. But that has not been the case at the moment. But it's not going to suddenly spiral into nothing. We will continue to have a business in China in the years to come. As far as the response of the AIM market to the content of this presentation, I think the people here have a better understanding of that than I do. I'm an antibody technology guy. My only guess would be that people who think short term would look at the sales graph and think, oh, panic, panic, panic. Whereas other people might think, oh, that neurology stuff sounds really exciting, I might buy. And the market obviously is a balance of those two populations. Personally, I bought some shares because I thought it was a bit cheap.
I've got a couple of online questions here. Is this mic on, Matt? You can hear me, great. One interesting one. How will the news of government committing to phase out animal-derived antibodies affect you?
Not at all, not relevant to our business. Was that animal testing for therapeutic products? We use sheep at our farm to immunize them. Yeah, but that's not a kind of, it's a very mild medical procedure. So we do use sheep, But what we do to the sheep is we use human equipment to immunise them. We use human equipment to bleed them, and they live in a beautiful field in Hampshire. So that it's not an animal rights issue, and it's not. If you have a vision of monkeys with wires going into their brain, that's not Bioventix.
Okay, thank you for that, clearing that one up. Another one here from Ralph. Agreed that the Alzheimer's antibody future is large, but how many other competitors do you have? And what do you know about competitors also vying to make and supply antibodies for brain testing?
Well, our customers see a vision of the future where neurology testing will be big, so with a number of blockbuster products that they'll be selling. And everybody has that perception, and me and other antibody companies will have exactly the same perception. So there is a lot of competition, and I think the right hand column that Bruce is referring to is actually a bit of a surprise to me that we're doing so well against the competition, and I'm genuinely a bit surprised by that. And I think it's a function of the fact that we still make good antibodies, although our technology is quite long in the tooth. And I think the other key factor is the fact that our antibodies have been validated by the Gothenburg group, who have command a position of global respect.
Okay, so the quality position in a way helps you to keep that market share.
It helps us done what we've done, and when you get, as I mentioned on slide 3 or slide 4, when someone decides to use your antibody, they've done that very, very carefully, and they very rarely go back on such a key decision.
Okay, thank you. And another one here online, Alex, what percentage of revenue is coming from China at the moment?
I think that might be in the account somewhere. It's gone from maybe 25% to something lower than that, maybe 18%. I think it's in the detailed accounts.
It's in the accounts, Alex. So have we got any more questions in the room? Yes, gentleman here. Pavlina, have you got the microphone?
Thank you. Your company is a great company in terms of aim. If you compare this company with most, it has a lot of money, very successful, few people, but to the world, to us, you are the company. And it therefore raises an issue for shareholders like me. What about succession planning? Because not only are you the company, but if you look at your LinkedIn profile, it's a Jaguar E-Type, I think, which has a certain hazard around it. So how about succession?
Well, I'll take the second element of that question. It's a 1969 Series 2. It's a soft top, but it does also have a winter hard top. It's a great piece of kit. It's just fantastic. I can't remember the rest of your question, but for me, that was the most important element. Oh yeah, succession. I think I'll keep the E-Type. I don't think there's any. I really don't see it's the most beautiful car I've ever had. I don't really see the need to consider switching.
Oh, it's the Peter Harrison.
Oh, got you.
Yeah.
Well, as far as my participation is concerned, I'm 66 3/4, or maybe a bit more than that. But my plan is, because I quite enjoy doing what I do, I'll continue for as long as feasible. Clearly, when you're 66 3/4, you worry about being 67 and also health issues. So that's something which is not predictable, because some of my contemporaries are going through issues. I'm not, which is great, but obviously that can change precipitously. As far as succession planning short term, in the event that something happens to me precipitously, then Ian, the chairman, knows lots and lots of people in UK biotech and would be able to parachute in probably 2 people, an operations guy and a research guy, to cover what I do, because I do 2 jobs in one. Medium term, obviously things come to an end for everybody, and that succession will need to be planned. And we think we'd need about a year to find the right candidate and to have an appropriate handover. But for me, that's kind of down the road a little bit. I think the other point of comfort for shareholders is that there's an immense momentum behind what we've already done. So, for example, with neurology, all the sort of little collaborations and the antibody evaluations that they've done, so it's gone into manufacturing where people place orders, and that's not intellectually challenging. We get an order on the email, and it's someone wants tau NT888, and it goes to the scientists, and they ship, they prepare it, and Kirsty FedExes it off to the States or to China or Japan or Germany. So, and there's an immense amount of continuity, such that if I were to vaporize tonight, it probably wouldn't affect the finances for quite some time because of the inertia. I mean, I still like to think I contribute, but I don't think it'd be quite as catastrophic as you're suggesting.
I'm afraid we've run out of time, Peter, but that was very interesting, and I wish you well with your Jaguar. And I hope to hear more from you at some time in the future as well. It sounds like you're sticking with it for a while, which I'm personally, as a holder, am pleased about. So,
very good.
Thank you.
Good night to see you all.
Thank you.